So about 40% of women who come off the pill are met with menstrual issues. The pill is not a solution to women coming in with health issues. It's handed out like candy when women present with any hormonal issue. And the body, remember, it always rebounds. So if something's suppressed, and the longer it's suppressed, the moment you get off of it, there's a rebound effect. And post-birth control syndrome is that. Now, I want to speak on birth control. I understand this topic can be very sensitive, right? Especially with the current climate out here in the United States, and especially coming from a man. But my goal is not to sway you from a decision whether or not you should take it. But it is absolutely, as always, for whatever it is, to provide informed consent. So you have all of the information, you decide. What you decide is what you decide. It's outside of my hands, and I care only that you know the information, okay? So birth control pill is continued to be one of the most popular forms of contraception available for women in America and all over the world. 1960, the first oral contraceptive was introduced. The FDA approved it, and the name of it was Enovid. It was a progesterone and estrogen mix, and it was known as the pill. So according to the American Medical Association, within 2 years of its initial distribution, 1.2 million Americans, women, were using birth control pills, or the pill, as it was popularly known. And since its introduction, more than 300 million women worldwide use the pill as a simple, safe, and effective means of achieving reproductive freedom. Or is it? So how do they work? Oral contraceptives contain estrogen and progestin. They're a combination of both, most of them. That's a combination pill. And it basically works like this. It keeps your ovaries from releasing the egg, as you know, but it blocks the communication between the brain and the ovaries. It's basically shut down for as long as you're taking it. Before we go into using birth control, who shouldn't be using birth control? Really important. We need to know this. Anyone with clotting disorders, anyone with a history of breast, uterine, or liver cancer, anyone with a history of stroke or heart attack, anyone with a disease that affects your blood vessels like diabetes or high blood pressure, gallbladder disease, very important. I'm going to talk a little bit about this later. Make sure you talk to your doctor in detail, right? Be very clear about your medical history. They need to know this before you start. And if you smoke and take the pill, your risk of heart-related events skyrockets, especially if you're over 35. So before I jump into this, I want you to know that anytime you take a medication, whether it's birth control, whether it's an asthma inhaler, you should always look at something called the package insert. So what you can do is type in the medication, the name of it, right? And for this one, we'll be talking about Alessi, and that is the birth control. And then you can type in package insert and open it and just read through maybe the 10, 15, 20 pages of information. And it's important for you to know because this is true informed consent. This is an insert that needs to be legally transparent about what are your risks for taking this medication. Unfortunately, a lot of doctors don't go through the risks the way they should. So in the package insert for one of the most popular birth control pills, Alessi, out there, what we see is that there's an increased risk of several serious conditions that include venous and arterial thrombotic or thrombolytic events. These are blood clots, right? Such as myocardial infarction, a heart attack, thromboembolism, and stroke. Hepatic neoplasia, increased risk for liver cancer, gallbladder disease, blood pressure, right? Although all of these really serious risks are small, a lot of people, one of the first things they ask me about birth control is, will it raise my risk for cancer, particularly breast cancer? And I've always been saying the same things for a while. And actually, if you look on the package insert, the quote by the company is this: the risk of having breast cancer diagnosed may be slightly increased among current and recent users of combination oral contraceptives. However, this excess risk appears to decrease over time after combination oral contraceptive discontinuation happens. By 10 years after cessation, the risk basically disappears. And I actually stand by that. All the research is saying that as you get off birth control, it takes about 10 years for your risk of breast cancer to decrease. There is an elevated risk, but I will say this. Your risk goes up the earlier you start taking it and the longer you start taking it. So the longer you're on it, your risk is higher and higher. Also, remember, not everyone's created the same. So if you're predisposed, you have a family history or personal history of breast cancer, or I just did a show on estrogen and estrogen metabolism. If you're not breaking down estrogen properly in the liver, if you're constipated, you have all of these other issues with your gut, then it stands to believe that your risk for breast cancer is elevated as well. What's another cancer associated with oral contraception? Indirect calculations have estimated that attributable risk for liver cancer to be the range of 3.3 cases per 100,000 users. So it's small and it's there, but it increases after 4 or more years of usage. So again, if you have a family history of liver cancer, if you have hepatitis, if you smoke, if you drink, if you have any liver issues, right? Really important to know, because the pill is taxing on your liver. And if you're taking birth control, you need to get your liver tested once a year. Go ask your doctor for an AST test, ALT, ALP, GGT, and bilirubin. 5 tests to see the health of your liver and gallbladder to make sure that you're clearing, filtering, metabolizing, and the health of your organ is optimal overall. Also consider doing a liver supportive protocol while you're on your regimen. Talk to your doctor about what herbs or nutraceuticals would best fit your picture of health. What else can you do to support your liver when you're on the pill? Eat sulfur-rich foods. Really important, cruciferous vegetables, broccoli sprouts, really one of my favorite ones, broccoli, cauliflower, kale, Brussels sprouts. Eat more root veggies, beets, carrots, artichokes. What about quality protein? If you're vegan, make sure you're getting enough protein-rich foods. I would also suggest having healthy fats like coconut oil, avocado oil, cold-pressed organic olive oil, olives. Make sure your hydration is really, really up to par, about half your body weight in ounces. This is really important. If you're on the pill, the other side of it is that you really need to take care of yourself even more. And you gotta get rid of the things that disrupt your liver health. High fructose corn syrup, sugary foods, alcohol, cigarettes, seed oils like canola oil, soy oil, cottonseed, safflower, sunflower oil. Get off of those seed oils and make sure that you're really protecting your liver. If you're on the pill, you also got to do the same thing with your gut. You have to make sure you're taking care of your gut. If you have gut issues, if you're constipated, big issue. I actually wouldn't recommend someone to be on the pill if they're constipated or with gut issues. So make sure you're optimizing your gut health. Why? The gut plays a major role in estrogen metabolism, right? After it's broken down in the liver, your estrobolome, the bacteria in your gut, release something called beta-glucuronidase. This is an enzyme that helps liberate estrogen. When it's imbalanced in the body, beta-glucuronidase is overactive, and what you're doing is liberating more and more estrogen. You need to be pooping if you are on birth control. This is so important. We can't play around with this, okay? Your gut health needs to be at the highest, most optimal. Remember, the pill would disrupt your gut microbiome too, and its integrity, so making sure your tight junctions of your intestines are really, really at the most optimal health. Taking care, utilizing herbs that soothe the gut lining, utilizing probiotics for fermented foods, prebiotic foods that are actually feeding that gut microbiome. All the things you need to do if you're on the pill. Oral contraceptives have been shown to cause glucose intolerance also for a significant percentage of users. Oral contraceptives containing greater than 75 micrograms of estrogens can cause hyperinsulinism, right? While the lower dose of estrogen can cause less glucose intolerance. This is important. This may be the sole reason why there's certain people, there's a group of women who take birth control who actually develop new acne. It could be because of blood sugar dysfunction. Now, metabolic health is a major driver of disease, period. Not just acne. When you couple that with a chronically poor diet with inflammatory foods, what you're going to see is metabolic dysfunction that is going to cause issues in every single system in the body. A small proportion of women will also have hypertriglyceridemia. These are when your triglycerides are elevated. So if you're on the pill, make sure, along with the liver test that I just mentioned, you get the fasting glucose test, HbA1c, triglycerides checked every single year on a physical to make sure they're not out of balance. So what are some adverse reactions coming from oral contraceptive pills? Acne, amenorrhea, that's the loss of your period, anaphylactic reactions, including urticaria, angioedema, severe reactions in the respiratory or circulatory system, right? So any skin issues or shortening of breath can happen. Breast changes, tenderness, pain, enlargement of the breast, secretions through the breast. Budd-Chiari syndrome, this is when the hepatic veins start growing or block. They get blocked, and then the veins that drain to the liver are narrowed by a clot of cells. So this causes a backup in the liver starts growing. It's a big problem, medical emergency. Cervical erosion and secretion in the cervix. Chorea, which is a neurological disorder. If you have it, it's going to be exacerbated by birth control. Colitis, inflammation of the colon. Intolerance to contact lenses. You may have experienced this already. Changes and that's because you're having a change in the corneal curvature of your eyes. Dizziness, edema, fluid retention, very common. A lot of women gain weight on birth control. erythema multiforme, which is basically a skin disorder or allergic reaction. Erythema nodosum, these are bumps that are found symmetrically in the shins. You may have found that. Very common gastrointestinal symptoms like abdominal pain, cramping, bloating. Hirsutism, which is growing of hair in the body. You might find mustache hair, armpit hair growing. Infertility after discontinuation of treatment, very, very important to talk about, and I'm going to talk about it a little bit later. Issues with lactation, libido changes, melasma you may find. A lot of women get melasma with birth control. These are basically dark spots caused by estrogen in the face, exacerbated by the sun. Changes in your menstrual flow, mood changes, depression, nausea, nervousness. Pancreatitis, pretty common when it comes to inflammation of the pancreas when you're on birth control. Rashes, scalp hair loss, increase in folate levels in the serum, increase or decrease in your folate, your B vitamin levels, spotting of blood. Lupus can be exacerbated, vaginitis or yeast infections, varicose veins, vomiting, weight loss, weight gain. These are all things that we see in women who are on birth control. So we really have to understand, although the risks are small, they're there, and you can develop any of these, and is it worth it, right? And that's for you to answer, not me. And the following adverse reactions have been reported in users of oral contraceptives: cataracts, cystitis-like syndromes, dysmenorrhea, issues with your period, hemorrhagic eruptions, optic neuritis, basically the nerve of the eye becomes inflamed, and kidney issues, right? So if you're on birth control, be very aware of any pain that you may have in your calf, sudden, sharp, deep pain, chest pain, shortness of breath, heavy chest. If you're suddenly dizzy or vomiting, have a severe headache, a fever, if you feel numbness in the body, yellowing of the eyes, if all of a sudden you develop lumps in the breast or pain in your abdomen, especially on the upper right part, pain in your reproductive organs, bowel changes, energy changes, sleep changes, mood changes, appetite changes, very, very important to take note of it and immediately talk to your doctor, okay? Aside from preventing getting pregnant, birth control pills are also utilized and prescribed for women with bad acne, irregular menstrual periods, and PMS. As a matter of fact, more than half of the prescriptions for birth control are for acne, dysmenorrhea, or PMS. That's 50%, right? And of that 50%, 31% are for menstrual pain, 28% for menstrual irregularities, 14% for acne, 4% for endometriosis, 11% for unspecified hormonal problems, and others, right? But it's crazy to me because we're not treating the root cause of acne. We're just giving a pill, assuming that it's a hormonal thing. And it isn't always. And it will help when you're on it, but when you're off of it, it'll come back. We speak about all the things for skin health and the root causes of acne and how to heal it, and irregular menstrual periods and PMS. I spoke about that in a recent show. We gotta be optimizing our gut health, our microbiome, how we're breaking down estrogen in the liver, how we're detoxifying it. Are we optimizing it? Are we taking the things in, the foods, the supplements, the lifestyle stuff? These are all the things how we get to the root, not just giving a pill and assuming it's going to fix every ill, especially hormones. So to get back to rhythm, because a lot of you are going to go, okay, I want to get off birth control, and unfortunately suffer with something called post-birth control syndrome, which is real. A lot of women get off birth control and they suffer with so many ailments, and then they go, I need to go back on birth control. So I would actually recommend Dr. Jolene Brighton wrote a book called Beyond the Pill. It's a full breakdown of what birth control is, some of the risks that I spoke about on this show, but also she leads you and holds your hand to get through post-birth control syndrome, right? To make sure that you're able to restore your body. What do you need? Do you need to get on a protocol? How does it look for you, okay? So about 40% of women who come off the pill are met with menstrual issues. The pill is not a solution to women coming in with health issues. It's handed out like candy when women present with any hormonal issue. And as Dr. Brighton says in the book, I'm here to tell you the pill won't fix your period. It's not a long-term solution to hormonal imbalance by any means. And the body, remember, it always rebounds. So if something's suppressed, and the longer it's suppressed, the moment you get off of it, there's a rebound effect. And post-birth control syndrome is that. We see acne, hormonal irregularities come back, loss of menses, infertility, PCOS, hypothyroid. We see hair loss. I've seen that in patients. Depression, anxiety, gut issues, even autoimmune disease develop just by getting off the pill. Some tips to remember and how to temper post-birth control syndrome is understand that the pill is a nutrient depleter. So we have to replete ourselves with nutrients when we're on it, right? And by we, I see women. I'm just feeling really connected to this. So when we talk about the nutrients, B6, zinc, and magnesium are really, really important ones that we need to be replenishing. Go back to the book. She'll give you a full breakdown. And there you'll find protocols specifically for what manifests for you. If it's headaches, adult acne, hair loss, there's a whole chapter on irregular periods and all the manifestations of that with a protocol. And the likelihood is that you may suffer with 1, 2, or even all of these within 4 to 6 months of getting off the pill. So to get back, make sure you're starting with foundational stuff, organic fruits, organic veggies, beans, legumes, seeds, nuts, quality protein, more spices, healthy water, half your body weight at least in ounces, healthy fats, stress-reducing techniques. And also, there are alternative methods for birth control that you really should start looking into and see if it's right for you. There's the standard days method, cervical mucus or ovulation method, 2-day method, the symptothermal method, right? Condoms, as we know, diaphragm, sponge, copper IUD, which can come with its own set of issues. The pull-out method, tubal ligation. If you heard of these or haven't heard, start researching. Talk to your doctor and see if it's right for you, right? If you talk to your doctor and you're considering an alternative method and they can't help you, then find a new doctor. If they're pushing the pill instead, then put on your track shoes and run, right? You need someone to meet you where you're at on what you want to do and have the competency to help guide you. So if you're on the pill, now you have all of the information you need to make an informed decision. If you weren't given this information and just got right on the pill, it's really important to start considering what are the pros and the cons. And maybe, just maybe, you can go get Dr. Jolene Brighton's book, Beyond the Pill, read through it, see what it really means to you, see what aligns with you. Because for me, if I had a daughter and she wanted to be on the pill, and that was her decision, I would really guide her in all of the things she needs to be doing when she's on it, like protecting her gut, protecting her liver, getting on the nutrients that are depleted, and also giving her alternatives and helping her make the choice that is right for her. And do the same for yourself, and parents, do the same for your daughter.